Welcome to Human Interest Today. I'm Sitara Maruf. The use of herbal medicines and unconventional therapies by a growing number of patients has made a significant impact on the medical establishment. How significant? We'll take a look.
My heartbeat is calm and strong.
You may think this is taking place at a holistic center, but these are first-year medical students at Georgetown University's medical school. The school is revising its curriculum to integrate information about complementary and alternative medicine in all its courses.
My body balances itself perfectly.
Dr. Aviad Haramati is Director of Education and Principal Investigator on the Complementary and Alternative Medicine Project. He says the material is in context with basic science courses.
The idea behind this was to train a new generation of physicians that were capable, first of all, had awareness about what complementary and alternative medicine was. Not that they'd be practitioners of some of these techniques, but so that they would be able to provide information and guidance for their patients. Many of the faculty felt that this was part and parcel of helping the public seek out appropriate medical care. And so the tack that we took here at Georgetown was to determine what aspects of complementary and alternative medicine belonged in the science courses, which of the material belonged in our clinical courses, and which is most appropriately in some of our bridge courses, like Introduction to Healthcare, where they learn about practices.
Last July, the school received a $1.7 million federal grant for education about alternative medicine. Officials say the initiative at the school indicates the changing nature of healthcare in this country and the fact that a growing number of professionals in the field recognize that healthcare is a team effort.
There's a spectrum of healthcare professionals. That's important for students to understand. And so the idea of working in a team, understanding that there are other practitioners out there that could provide services for a patient, this is an important exercise. And so in some ways what this initiative is about building bridges. It's about building bridges between the conventional medical establishment and other practices, other healthcare professions that in years past were perhaps outside the mainstream, but are slowly becoming part of the mainstream.
Professor Michael Lumpkin is the chair of the physiology department. He's covering the elements of biofeedback in his endocrinology class.
Did anyone notice a change in their biodot color? Okay. It's important to recognize that we're not teaching a belief system. We're not saying that you must believe this and you must use it, but rather we want to impart the knowledge that's out there about complementary and alternative medicine to the students. We want to make them aware of the scientific basis of it when it's available. We want to make them aware of the safety and hazardous issues that are associated with the use of, say, herbal agents with classical drugs and these interactions that might cause exacerbation of diseases. So we are really trying to inform the students and to prepare them to interact with other practitioners of alternative medicine in a constructive way that's helpful to their patients.
Professor Haramati also points out the school is not advocating alternative medicine and practices. The rationale is to inform students on what's beneficial and what's dangerous about complementary and alternative medicine. The other fundamental is a sense of learning about themselves. Amy Little, a first-year student, says the introductory mind-body workshop has helped students in many ways.
The initiative at Georgetown is trying to reinstate the human element. And the first semester was very fast and full of science and somewhat traumatic just to a person not sure what she's coming into. And then the second semester to have this opportunity to meet in a small group with 9 other students and to take time out of your week to practice breathing and meditating and relaxing. Every week we had a chance to say how the practice of relaxation was impacting us. And you could see from the first week stressed, pinched faces of people who've just made it through their first semester of medical school to 10 weeks later, people who are learning how to be successful in all the science classes and yet be healthy and relaxed.
About 90 of the 125 medical schools in the country have some courses that discuss alternative practices.
What's different about what we do here is that it's not elective, that it's part and parcel of the curriculum, that the initiative over the next 5 years is to really incorporate things all through the 4 years, not as a peripheral elective.
Georgetown students agree the integrated alternative medicine courses in the curriculum will help them become better informed physicians.
It is a strength, I think, for us coming from Georgetown that we have been educated in this, and I think it would be worthwhile to let your patients know that you do know something about this. But I think, you know, regardless of whether or not you advertise it, your patients will be coming to you asking these questions, and you know, knowing that I have learned about these techniques and personally experienced a lot of these techniques, I feel that I can offer more sound advice.
The American Association of Medical Colleges reports that more than 90 of the 125 medical schools in the U.S. include some complementary and alternative medicine in elective courses.